Action.
I'm going to give you a stick. A little sting. You feeling sting?
No, not really.
Good. And out. So I'm numbing up the patient right now with some lidocaine. That's step one. And at this point, you're not going to be feeling anything else, okay? You're just going to be feeling some tugging and pulling. And please let the doctor know if you're feeling anything other than that, okay? All right. First thing we're going to do is going to use our scalpel, and we're going to make a small incision in the area where we just numbed. Step two. And now we're going to use a trocar. This is how big the trocar is. And we're going to put that in. The patient does not feel anything. You will not feel anything at this point. Now that it's in, I'm going to remove the thing that I used that was cutting through the flesh. That's out. And now we have our pills. There they are. That's how small they are. One's a Tic Tac and one's half a Tic Tac. And we're going to use these to load in the trocar that I just placed. One pellet loaded. 2 pellets loaded. And then to push the pellets in, we're going to use this. Feel a little resistance. Pellets are in. She doesn't feel any pain. There's hardly any bleeding. Even if you're on Coumadin, we can do this procedure, right? We would just have to give you more icing and more pressure afterwards, but it certainly can be done. Be clean off initially with iodine, and I'm going to use alcohol to wipe off the iodine. We're going to use a benzoin tincture. And that's going to help with removal of the steroid strips that we're now going to place as well. Just putting that on there for a little bit of oozing. And then we're going to use a steroid strip, and we're going to close. I'm going to put another steroid strip on for good measure. And then we're going to use the gauze for any oozing that may happen. Over the next couple of days, we're going to use that to close. And so now that the procedure is finished, this bandage is going to stay In women, this stays for 5 days, 3 days, sorry. In men, it stays for 5 days. And so we're not going to be doing any gluteal exercises. Can I get another bandage? We're not going to be doing any gluteal exercises. We're not going to be doing any vigorous exercising in general for 3 days in women. We're not going to be doing any squatting, right? And preferably, if people are going to have to bend, let somebody bend for you for the next couple of days. We don't want you immersed in any water, so we don't want you to be in a bath. We don't want you to be swimming. You know, if you go to the beach, you're not going to be going in like everybody else for the next 3 days. In 3 days, you're going to remove this entire thing. And this, the gauze, and the stereo.